Hello, I'm John Boyd. In 2005, a group of thyroid patients in Western Australia realised there was very little information available about thyroid conditions. Thyroid conditions can affect any age group. They are more commonly diagnosed in women, but can also affect men. Hypothyroidism, also known as an underactive thyroid, is the most common thyroid condition. Thyroid cancer, thyroid nodules, and hyperthyroidism, also known as an overactive thyroid, are less common. Thyroid disease can affect you physically, mentally, and emotionally, which can all add to the confusion in getting the right diagnosis. Autoimmune thyroid disease is often insidious and develops over a considerable time with general intellectual deterioration and changes in personality, often not noticed by friends and family members. Recognising your symptoms and conveying them to your medical specialist is a key step in obtaining a timely diagnosis. Thyroid function tests should always be used as a guide along with your symptoms, signs and family history. Another issue that may occur is that once diagnosed, patients may not receive optimal thyroid hormone replacement therapy and as a result may continue to suffer unnecessarily. Educating yourself about thyroid conditions will allow you to get the best health outcome. Topics we will be talking about include the thyroid function, what does the thyroid gland do, types of thyroid disorders, common causes of hypothyroidism and hyperthyroidism, symptoms, diagnosis of different thyroid conditions and treatment of various thyroid conditions.
So, what does the thyroid gland do? The thyroid gland is part of the endocrine system, which is the collection of glands that produce hormones that regulate metabolism, growth and development, tissue function, sexual function, reproduction, sleep, and mood, amongst other things. The thyroid gland sits just under the Adam's apple at the front of the neck and wraps around the esophagus. If you tilt your head up and look just under your Adam's apple, you can feel and see your thyroid. Thyroid hormone regulates metabolism, which is the rate at which food is turned into energy. It also regulates body temperature, heart rate, blood pressure, and body growth. Thyroid hormone is also part of the brain chemistry that regulates your mood, emotion, cognition, memory, appetite, and behavior. The thyroid gland is controlled by the pituitary gland, which secretes a hormone called TSH, thyroid-stimulating hormone, and the pituitary gland is controlled by the hypothalamus, which secretes a hormone called TRH, thyrotropin-releasing hormone. The main hormones produced by the thyroid gland are T4, known as thyroxine, and T3, known as triiodine thyrronine. If the thyroid hormone levels decrease, then the pituitary gland stimulates the thyroid gland to produce more thyroid hormone. It is called a feedback mechanism. If the thyroid hormone levels increase, then the pituitary gland stops stimulating the thyroid gland, so that less thyroid hormone is produced. The pituitary gland is stimulated by the hypothalamus. The most common thyroid disorders are hypothyroidism, where the thyroid gland does not produce thyroid hormone or enough thyroid hormone. Hyperthyroidism, where the thyroid gland produces too much thyroid hormone. Hyperthyroidism can also be caused by excessive thyroid hormone replacement therapy. Nodules, which are growths or lumps in the thyroid gland. Inflammation of the thyroid gland, called a goiter. Thyroid cancer. And thyroid eye disease. Thyroid eye disease, or TED, or TED, is not a thyroid disease as such, but is associated with Graves' disease. The most common causes of hypothyroidism are Hashimoto's thyroiditis. Hashimoto's thyroiditis is an autoimmune disease. The body produces antibodies that attack and destroy the thyroid cells, which mean that the thyroid gland is no longer able to produce adequate amounts of thyroid hormone. Every cell in your body needs thyroid hormone. We can't live without it. Iodine deficiency. Iodine deficiency results from a lack of iodine, which is needed by the thyroid gland to produce thyroid hormone. Iodine deficiency is a common cause of hypothyroidism worldwide. People with existing thyroid disease or family history of thyroid disease need to avoid both iodine deficiency and iodine excess, because according to research, more than an adequate amount of iodine can aggravate existing thyroid condition or initiate the disease. Iatrogenic hypothyroidism. Iatrogenic or doctor drug-induced hypothyroidism can happen as a result of a treatment for an overactive thyroid, thyroid cancer, or other medical conditions. The most common symptoms of hypothyroidism include feeling tired, feeling cold, increased weight, but weight gain is not significant in everyone, depression, dry skin, hair loss, and constipation. People may not have all of these symptoms, and these symptoms do also occur in other conditions. Hashimoto's thyroiditis is diagnosed by a simple blood test, indicating elevated levels of antibodies. Not all patients with Hashimoto's thyroiditis have elevated antibodies. An ultrasound may be able to detect Hashimoto's thyroiditis. The conventional treatment of hypothyroidism is thyroxine. There are two different names on the market, oroxine and utroxig, but they are identical products made by the same manufacturing company, except oroxine is more expensive. The theory is that all thyroxine T4 is converted to T3. The cells can only use T3, so if T4 is not converted to T3, you may remain hypothyroid despite having normal blood tests. It is recommended that you test your thyroid hormone levels 6 weeks after you take thyroxine or change your dose. It is best to take thyroxine on an empty stomach with water. Other medications, supplements, food and beverages should be taken later in the day because they may interfere with the absorption of thyroxine. Some people still have symptoms of hypothyroidism when they take thyroxine. People who are on full replacement therapy and suffer from depression or have other symptoms of hypothyroidism may benefit from a combination therapy of T4 and T3. Tetroxine is an authorized script and not every doctor will prescribe it under the PBS. Doctors who prescribe it under the PBS need to state the following: replacement therapy for hypothyroid patients who have documented resistance to thyroxine sodium. Integrative general practitioners can prescribe a combination therapy of T4 and T3 through compounding pharmacies such as desiccated thyroid extract, also known as ARMA, slow-release T3, combined T4-T3 capsules. Desiccated thyroid or thyroid extract is derived from a pig's thyroid gland. It is dried and powdered for therapeutic use. The ratio of T4 and T3 is not quite the same as in humans with generally too much T3 and not enough T4. Sometimes it may be beneficial to take thyroxine in addition to desiccated thyroid extract. The most common cause of hypothyroidism is Graves' disease. Graves' disease is an autoimmune disease. Antibodies stimulate the thyroid gland to produce more thyroid hormone, resulting in excessive levels of thyroid hormone. One nodule or multiple nodules in the thyroid gland start to produce thyroid hormone on their own, which may produce symptoms of hypothyroidism. The pituitary gland responds to the excess level of thyroid hormone by reducing the thyroid-stimulating hormone, TSH, as thyroid hormone levels start to rise. But the nodules don't respond to the TSH. People diagnosed with a toxic multinodular goiter or a solitary thyroid nodule don't usually experience severe symptoms of hypothyroidism, and the nodules are not associated with the bulging eyes or thyroid eye disease experienced by some people with Graves' disease. The most common symptoms associated with hypothyroidism include rapid pulse and heart palpitations, fast heart rate, tachycardia, increased perspiration, weight loss or weight gain, feeling warm or hot even when it's cold, hand tremors, irritability, anxiety, nervousness and panic attacks, shortness of breath, loss of strength, menstrual periods become light or stop altogether, frequent loose stools or diarrhea, psychological symptoms, depression, fear or irritability, and many more. People may not have all of these symptoms, and these symptoms also occur in other conditions. These symptoms do not always occur at the same time. It's possible to have one or two or more of the symptoms at any given time. Graves' disease is diagnosed by a simple blood test indicating elevated levels of thyroid-stimulating antibodies called TSAB. Other names for TSAB are TRAB-TSH receptor autoantibodies, TSI, thyroid-stimulating immunoglobulin. Your TSH may be low or undetectable, and your thyroid hormone levels may be raised. Antithyroid drugs are used to reduce thyroid hormone production. The doctor may prescribe either neomercazole, also known as carbimazole, or propylthiouracil, also known as PTU. Doctors prefer to use PTU during pregnancy because it is considered a safer option than carbimazole. Initially, a high dose of antithyroid drugs is prescribed, and as the thyroid hormone levels decrease, lower doses of antithyroid drugs are given. It usually takes a few weeks before the drugs start to work. 30 to 50% of patients achieve remission within 6 months to 1 year. Some people may need antithyroid drugs for 18 months or even longer before they achieve remission. Beta blockers and tranquilizers may also be prescribed. However, these drugs don't treat the disease, but temporarily relieve symptoms associated with hyperthyroidism, such as palpitations, anxiety, or a fast heartbeat. Some potential problems that may occur as a result of the antithyroid medication are liver damage. This is uncommon, but if it happens, then it usually occurs in the first 3 months. When liver function test becomes abnormal, the medication will be stopped immediately. Aplastic anemia. This is the suppressed production of red blood cells in bone marrow and is considered rare. Agranulocytosis is also considered rare, but usually occurs in the first 3 months as well. Agranulocytosis is a severe decrease in the production of white blood cells and may put the patient at risk of serious infections. If you experience a sore throat and/or a fever, report this to your doctor immediately and have your white blood cell count measured. Vasculitis is the inflammation of blood vessels. Radioactive iodine is used in adults only. It can destroy a significant portion of the thyroid gland, so it can make you permanently hyperthyroid. It cannot be used during pregnancy and is not recommended if you suffer from thyroid eye disease. Surgery is used as a last resort and may be done by an experienced surgeon who predominantly performs surgery on the thyroid. Many of you may have heard the terms goiter and nodules. Goiter is an enlarged or inflamed thyroid gland. The most common causes of goiter are autoimmune thyroid disease, Hashimoto's thyroiditis, or Graves' disease, and also iodine deficiency. Goiter can also cause difficulties in swallowing and breathing. A nodule is an abnormal growth or lump in the thyroid gland and can be non-cancerous, benign, or cancerous, malignant. There are 2 types of nodules, hot and cold. A hot nodule is functioning and a cold nodule is not functioning. This is diagnosed by a nuclear thyroid scan or functional scan, also called radioactive iodine uptake test. A hot functional nodule takes up large amounts of iodine during the scan, whereas cold, non-functioning nodules do not. Hot or warm nodules account for 15% of nodules detected and do not have high risk of cancer. Cold nodules account for 85% detected, with only 10 to 15% cancerous. If you have goiter or you can feel a lump or nodule in your neck, it is important to speak with your GP or specialist about the underlying cause of it. If your nodules are small and don't cause problems, and your thyroid is functioning normally, your doctor may suggest a wait-and-see approach. Surgery is usually recommended for a large multinodular goiter that causes breathing or swallowing difficulties. It is often the treatment of choice for hot or toxic nodules. Radioactive iodine. Hyperthyroidism caused by hot nodules can be treated with radioactive iodine, which may shrink the nodules. However, the radioactive iodine may damage adjacent thyroid tissue. If too much thyroid tissue is destroyed, then the patient may become hypothyroid and will need thyroid hormone replacement therapy for life. Alcohol ablation is when ethanol is injected into the nodules, which make them shrink. Thyroid cancer. Papillary thyroid cancer is the most common type of thyroid cancer and has a very reasonable prognosis, even if the cancer is found in the lymph nodes. Follicular thyroid cancer is the second most common cancer, and it can spread to the lymph nodes or other parts of the body. It still has a good prognosis. Less common thyroid cancers include medullary thyroid cancer, which can be hereditary, anaplastic thyroid cancer, and thyroid lymphoma. Most cases of thyroid cancer are discovered by accident. There are often no obvious signs of thyroid cancer. However, you may have one or more of the following symptoms: a lump in the neck or throat that may get bigger over time, difficulty breathing or swallowing, swollen lymph glands in the neck, a hoarse voice. Please note, these symptoms can also occur in people who don't have thyroid cancer. Talk to your GP if you have any of these symptoms. Thyroid cancer often develops slowly, without obvious signs or symptoms. Treatment for papillary and follicular cancer. The most common types of thyroid cancer includes surgery, which is usually done by an endocrine surgeon, radioactive iodine treatment. This requires a hospital stay where you need to stay in isolation. A urine test is used to check your radiation level, so drinking plenty of water will assist in flushing radiation levels. After the radioactive iodine treatment, thyroglobulin levels and its antibodies will be measured. Sometimes it is necessary to receive subsequent radioactive iodine treatments. After the treatment, you will need to take thyroid hormone replacement therapy for life to replace the hormones normally produced by the thyroid. For follicular or papillary cancers, initially the endocrinologist will aim for a TSH, which is suppressed to prevent the growth of any cancer cells. You may have heard of thyroid eye disease. TED is very rare. It is usually associated with Graves' disease, but sometimes associated with Hashimoto's thyroiditis and can occur without a thyroid condition. It is caused by an autoimmune condition which may result in inflammation of soft tissue and conjunctiva, swelling in fat tissue around eyes which causes bulging, and inflammation and loss of function in eye muscles. 5% to 10% of people have severe problems requiring aggressive treatments, but many improve spontaneously. So how is your thyroid function tested? Typically, a person with hypothyroidism has a high TSH, thyroid stimulating hormone, or elevated TSH, and a low normal or below normal free T4 and free T3, which are the thyroid hormone levels. However, a normal TSH does not rule out hyperthyroidism, especially with the presence of positive antibodies, low free T4 and free T3 levels, and classic symptoms of hypothyroidism. The normal range of the TSH is very wide. Hashimoto's thyroiditis is such a common illness, which means that many people who are already in the early stages of the disease may be included in the normal reference range. In hyperthyroidism, the TSH is low or not detectable. However, people who are on a combination therapy of T4 and T3 often have a low TSH, but the thyroid hormone levels are within the normal range. Research has shown that it may be safe to have a TSH level between 0.04 and 0.4 milli-international units per litre, which is below the normal reference range. Some patients only feel well when their TSH is low with thyroid hormone levels at the upper end of the normal reference range. This bell curve for thyroid function tests shows the TSH distribution taken from a sample of 65,000 people. The normal reference range is 0.2 to 4.5 milli-international units per litre. The normal reference range does vary, depending on what laboratory you go to. A panel of experts from the National Academy of Clinical Biochemistry, NACB in USA, recommended a reference range of TSH 0.5 to 2.5 milli-international units per litre for the TSH in 2002. According to many experts, a TSH over 2.1 is very suspicious, and it may indicate that you are early stages of thyroid disease. This means that a normal TSH does not necessarily rule out hyperthyroidism. Patients need to get a copy of their results, and the results need to be interpreted properly and used as a guideline. Keep a symptoms journal to help you when you consult with your GP. It is also a good idea to use the same lab, so it is easier to compare your results. Treatment of hypothyroidism should be based on each patient's individual circumstances. A therapeutic trial of thyroxine may be considered for people with lower levels of free T4 that are within the normal range or below the normal range and have classic signs and symptoms of hypothyroidism, especially for anyone with positive thyroid antibodies, people with a history of autoimmune thyroid disease, women who are planning a pregnancy where optimal thyroxine levels are needed for the baby's brain development, especially in the first trimester. Optimal levels may also prevent infertility and miscarriages and other pregnancy-related complications. Also, people with increased cholesterol levels or other risk factors for cardiovascular disease. Children and adolescents, as optimal thyroxine levels play an important role in growth and learning abilities. If your GP suspects a thyroid disorder, they will request an initial TSH. If the TSH is abnormal, then the GP may ask for a full thyroid function test. You can claim a full thyroid function test from Medicare, item 66719, if you satisfy one of the following conditions as indicated on this slide. You can always request a full thyroid function test through private billing if you do not meet the Medicare conditions. That is, you pay for the tests. Item number 66719 for thyroid function test comprises of TSH, free T4 and free T3. The laboratory should test the free T4 and the free T3 if the tests have been requested on the referral form by the doctor and it is clear you will be paying for the tests. For more information on item numbers, you can check online at www.mbsonline.gov.au under MBS. To summarise, diagnosis and treatment of thyroid disease should be based on signs and symptoms, family history, and proper interpretation of thyroid function test results. Talk to your family members about their medical conditions to find out if there is a family history of thyroid disease. Symptoms of thyroid disorders can be many and varied. The symptoms or signs of an underactive thyroid may be misdiagnosed as separate conditions. For example, depression, carpal tunnel syndrome, hypercholesterolemia, sleep apnea, hypoglycemia, anxiety, infertility, insomnia, and so on. Autoimmune thyroid disease, Hashimoto's thyroiditis, and Graves' disease can be diagnosed with the following blood tests: thyroid antibodies TPO and TGAB for Hashimoto's thyroiditis, and TSI for Graves' disease, TSH, free T4 and free T3. Importantly, getting the right dose will take time. What works for one person may not work for you. We are all individuals, but the main thing is that you keep trying until you have found what works for you. The blood tests should be used as a guide, but should never be used solely to treat or diagnose hypothyroidism or hyperthyroidism. For optimum absorption, take thyroxine on an empty stomach at least half to 1 hour before breakfast or 3 hours after evening meal. Also ask your GP or pharmacist for a list of over-the-counter supplements and/or medications which may interfere with the absorption of thyroxine or which may affect thyroid hormone metabolism. Avoid fad diets. Eat a wholesome, balanced diet. Limit sugar and unhealthy fat. Or see a nutritionist for a healthy eating plan. Once your thyroid hormone levels are normal, or you feel you have enough energy, then try exercising regularly, such as walking. Importantly, talk to other people with thyroid problems, as you are not alone.
We hope you found this presentation informative. Please seek professional medical advice for further information.